Ectopic pregnancy roleplay.
Good evening, everyone. My partner and I will be performing a OB roleplay about ectopic pregnancy of a woman. As the characters, we have Sales as the patient and me as the nurse.
Case scenario. Sales was transferred to the hospital from her local clinic at the gestation stage of 13 weeks because of lower abdominal pain and vaginal bleeding.
Hello po, ma'am. Um, I'll be your nurse for today po, Christian Stone. May I know your name and age po?
I am Maria Carla Sales and I am 35 years old.
Okay po. So, how can I help you for today, Miss Sales?
I feel like my right lower abdomen is pain.
Can you describe this pain for me?
I feel like I'm stabbing
And anything else po?
and I've been experiencing vaginal bleeding.
When was your last menstruation period, Miss Sales?
January 12.
Okay. Have you had any history of pelvic inflammatory disease po?
None po.
What about previous tubal surgery?
None din po.
Previous ectopic pregnancy po?
None po.
None. Okay po, ma'am. So, okay. Thank you, Miss Salas. Before we proceed with the doctor, I will be observing and assessing your vital signs first. Would that be okay with you, ma'am?
Yes po. Yes
Okay.
po.
Perform hand washing. Provide privacy.
So first, ma'am, I'll be taking your temperature first. So I can see it's just normal po. Now I'll be taking your blood pressure, ma'am. So, ma'am, your blood pressure is really low. 90/64. Now I'll get assessing your heart rate and your respiratory rate. Your heart rate is over 110. Respiratory was 7. So, ma'am, I'll be just palpating your abdomen for tenderness. So it feels broad light. Now I'll be assessing your bleeding po. I can see it is dark red po and heavy bleeding now. So thank you, Miss Salas. Please wait for a while. I'll be calling the doctor now.
Okay po.
Sales has went undergo ultrasound to find out what was the problem.
Hello again, Miss Salas. We finally got your results. According to your assessment and diagnostic test, I'm sorry po, ma'am. you are diagnosed po with ectopic pregnancy po.
What is the meaning of the ectopic pregnancy, nurse?
It means, in a simple way po, ma'am, it means instead the fetus of developing in the uterus, it developed in the fallopian tube.
So, what caused this po, nurse?
The fertilized egg po wasn't able to move down the fallopian tube quickly enough because of inflammation or misshapen of the fallopian tube po. Because the fallopian tube is not made to hold a growing embryo and can't stretch like a uterus, ma'am. And because of this, this condition can lead to bleeding po. And because of this, ma'am, we need to treat this immediately. Unfortunately, this ectopic pregnancy is fatal for the fetus po. It cannot survive outside the uterus, and with quick treatment for an ectopic pregnancy, it's important to protect your life po, ma'am. If the egg has implanted in the fallopian tube and the tube bursts, there can be severe internal bleeding po.
So, what will be the treatment for this, nurse?
For the main treatment, there are options, ma'am. First is expectant management, which is your condition is carefully monitored to see whether treatment is necessary. Second is medication po. The medicine that you'll be taking is called methotrexate, which is used to stop the pregnancy from growing po. And finally, ma'am, surgery. This surgery is used to remove the pregnancy, usually along with the affected fallopian tube po.
Oh no. Is there other way to prevent this?
Sorry po, ma'am, but there's no way to prevent the ectopic pregnancy po. But here are some ways to decrease the risk, ma'am. Firstly, limit the number of sexual partners, ma'am, and you should use a condom during sex to help prevent sexual transmitted disease and reduce the risk of pelvic inflammatory disease po. And ma'am, lastly, if you are smoking, I suggest that you should stop and quit smoking po.
Okay po. Thank you very much, nurse.
Everything will be okay po, ma'am. A sulpectomy is a surgical procedure, ma'am, where one or both of the fallopian tube are removed, and it is performed to treat certain conditions of the fallopian tube and ectopic pregnancy po. And of this, preventive measure for women like you, ma'am, at higher risk of developing ovarian cancer po.
I see. Thank you very much po,
So
nurse.
everything will be okay po, ma'am.
Miss Sales was diagnosed with ectopic pregnancy, and with that, she followed the nurse's advice and went undergo surgery to remove the affected fallopian tube.